More than 4 months after we began changing our lives to stop the spread of COVID-19, one of the surprise benefits has been the low number of people with the flu. And that's thanks to our lockdown measures, keeping your distance, closing borders, better hand hygiene, closing some schools, and now wearing masks.
It's great news. I think if we could get this sort of effect every year, we'd be very happy.
Looking at the month of June alone, last year, 57,000 people were diagnosed with the flu. In June this year, it was just 216. Even more remarkable is the reduction in flu deaths. In June last year, 161 people died. In the same month this year, there were no deaths from the flu. And it's a trend that holds true across the year, with cases down from 132,000 to 21,000 this year, and only 36 deaths so far this season. Having our borders closed meant that this year's influenza strain, which normally comes from the Northern Hemisphere winter, didn't make it down here. There's also been a big uptake in flu vaccinations. The latest data shows 8.8 million of us have had a flu jab. That's 2 million more than last year. Given the number of people that die from the flu outweighs the number of people who died from coronavirus in Australia, you might be thinking, why can't we just live with COVID-19?
The mortality rate or the death rate from COVID-19 is much higher than influenza. We know from previous years that around 1 in 1,000 people who become infected with influenza would die, but for COVID-19, unfortunately, it's much higher at around 1%.
With uncertainty about when international travellers will be allowed into Australia, experts say it's too early to tell what the flu season might look like next year. Sophie Scott, ABC News.